much, and thanks for being here. I will confess, as a non-technologist, it's a little hard to follow Eric. I will also confess that after seeing that map of all of the planes in the sky, I'm not sure I'm ever going to fly again. But that's what technology does for us. So I know you heard earlier from my colleague Roy Austin, and also you're going to hear a little bit about some of the work that we were able to do with Raed Ghani. So I'm going to apologize in advance if I repeat any of the things that Roy may have said. But Roy is kind of like my work spouse. We share the same brain, and we're focused very much on similar issues. But I did want to start. We very creatively titled this speech, Challenges and Opportunities with Artificial Intelligence and Criminal Justice. And we have to start with the challenges because the challenges are significant. So as you may have heard before, we have a large and problematic criminal justice system. We lock up more people per capita than any other country in the world by far. There are 2.2 million people behind bars today across the federal, state, and local system. As you can see from this slide, the people that we have locked up are not representative of this country. They are disproportionately racial and ethnic minorities. They are disproportionately suffering from challenges like mental illness and substance abuse disorder. Our criminal justice system incarceration rate has grown 220% since 1980. Every year, we spend $270 billion to run this system. Oh, sorry. One of the other things that we know is that the system does not affect people in the same way. At every stage of our criminal justice system, African Americans and Hispanic receive worse outcomes. They're more likely to be stopped. They're more likely to be searched for evidence. They're more likely to be arrested. They're more likely to be convicted. And when they are convicted, they tend to get longer sentences. So needless to say, we have significant problems. And I know Roy touched earlier upon the challenges that we face with data collection. But I want to talk a little bit about some of the different challenges that we see with the way that data is currently being used in the criminal justice system. Some of you may have seen a ProPublica article that came out in the last couple of weeks that talked about risk assessment tools. There was also an article about a year ago from the Marshall Project and 538 that looked at a sentencing tool that was under consideration. These are the kinds of questions that are being asked to help determine who gets released from jail and how long people should be serving their sentences. Was one of your parents ever sent to jail or prison? Who raised you? And there's a series of other questions under this who raised you. Were you raised in a two-parent household? Were you raised by one parent? Were you raised by a non-family member? Based on the screener's observation, is this person a suspected or admitted gang member? Very curious to know what kind of training goes behind that question. How many of your friends or acquaintances are taking drugs illegally? These are risk factors that are going into a potential tool that Pennsylvania is considering to determine the length of people's sentences. If you look at it, you get an extra point if you're a male. You get 3 extra points if you're under 24. You get 2 extra points if you live in Allegheny or Philadelphia counties. So you're starting right off the bat. If you are a male under the age of 24 in either Philadelphia or Allegheny, you're at 6 points on a 14-point scale. If you have been arrested once for a drug arrest, you get an extra 2 points because they're counting total prior arrests plus drug arrests. I don't intend to say that the people who have created these tools did so for bad reasons. As you may have heard, I have spent my entire career working in these systems, and the people who run these systems are good people who are dealing with a very large and unwieldy problem. But the problem with these tools that we see is that they are based on the data from decades of policy decisions. These tools and these numbers reflect the system as we see it now, not the system as we want it to be. So these tools are probably, statistically speaking, quite accurate when you're trying to figure out who is the most likely to predict crime. But when you think about all of the survey data that shows that whites and blacks use drugs at the same rate, and yet blacks are arrested 3 times more frequently. We know that the data that are going into these systems are profoundly flawed. So the tools that are emerging from this flawed data are giving us the kinds of questions that I suspect most of us don't want to be asking, and certainly don't want the folks who are in charge of these systems to be considering as they're trying to determine whether the individual human being standing in front of them deserves to stay in jail for a shorter or longer period of time. So as you can see, the challenges that we're struggling with here are significant. But I wanted to kind of turn a little bit to the opportunities that we see. Because the folks in this room, and some of them already have, can help significantly as we're trying to figure out what do we do with the system and how do we make it better. So Raid, I don't know if he stepped out. I saw him earlier. There he is in the back. I think Raid may have spoken to you a little bit earlier about this great summer fellow programs he has, where they send teams of data science fellows to help tackle really hard problems. One of the hardest problems that we're struggling with today in this country is how do we start to rethink the way that we deploy police in our communities. We all know about the significant struggles that we've seen since Ferguson happened over a year ago, really trying to understand how do we rebuild trust between the police and the communities that they are committed to serve. So Raid came forward when we first launched the Police Data Initiative, and he offered us a team of data science fellows. And we sent them down to work with the Charlotte-Mecklenburg Police Department, which is one of the largest departments in the country. We started with the idea that one of the things that really concerns community members is inappropriate use of force. So what Raid and the team of fellows did was they took unjustified uses of force and let the data tell them what is most predictive. And we learned, as we often do when we really take a deep dive into data, a couple of things. One I always find is some of the things that you see validate what you expect. So really the first swath of indicators that were most predictive are that past bad behavior is predictive of future bad behavior. But if you look about 10 to 11 indicators down, you'll see a factor that says the number of suicide events that an officer has responded to. So what this told us was a couple of things. One, it just reinforced for all of us that what we ask our police officers to do every day is an extraordinarily hard job. We call them to respond to situations that we can't handle. We call them to respond to some of the hardest, most emotionally trying situations that we ever encounter in our lives. And they are human beings. And when we are dispatching them to suicide calls, it turns out they need a little extra time to work through those problems. But the other interesting thing that we learned from this was that the police officers themselves told the fellows that this was a problem that they anticipated. So one of the great things that the fellows did was they actually sat down before they ever started this project, and they spoke to line officers. And they said, what are the things that you think cause you to have trouble when you're dealing with the public? So the officers themselves said it was suicide calls. The other thing that they flagged, and this is a very long list, Raid very helpfully cut it off so that it's readable. The other thing that they said is that they feel very stressed after they've responded to domestic violence incidences when there are children in the home. So what we actually learned from this was we started from the idea is how is it that we can figure out who are the officers that need help so that they are dealing with the public in the way that they should be. But what we really learned is that that is only one side of a very important coin. We also need to be figuring out how do we help these officers cope with the things that they deal with so that they themselves are safe, they themselves have the space that they need to cope with these things, and that in taking care of themselves, they can take care of the community more effectively. The other thing that we really see is there are all of these unbelievable new technologies that are emerging in the criminal justice space, very few tools that actually help us analyze these. So the Oakland Police Department, some of you may know, has been under consent decree for over a decade now. They made the decision, and it's interesting, if you actually go back and look at the consent decree language, you did not have to read that consent decree language to require them to deploy body-worn cameras. But under the leadership of a new chief, they decided that one of the things that they could do to help rebuild trust was to actually put cameras on their officers. And they did so far sooner than most police departments in the country. And what we can see is that the initial results are very promising. And I should also give credit to Assistant Chief Paul Figueroa. He put that arrow in there. He was very proud of himself. Told me it took him 45 minutes, so if anyone thinks that our law enforcement folks wouldn't love the help of smart technologists, this is a great example of it. We can see already two really important things that happened when Oakland deployed their body-worn cameras. One, use of force reports went down. Two, use of force complaints went down. And I should explain that spike was for the Occupy Oakland protests, but you can see the actual complaints, the uses of force went down as well. So this is a really great indicator that perhaps we're onto something here with body-worn cameras. But I will also tell you that Oakland collects 8 terabytes of data a month. LAPD is about to deploy body-worn cameras in across their entire department. That's going to be 600,000 hours of video a month. We currently have no way to actually comb through that data. So think of all of the things that you could learn when you have hundreds of thousands, if not millions of hours of police data on body-worn camera. We would actually know what policing looks like on the street. We would be able to identify not just the officers that may be having problems, but also those officers who magically seem to be able to de-escalate any situation they encounter. If you talk to any captain or any sergeant of any patrol unit, anyone would be able to tell you the 3 to 4 guys on the force that no matter what the situation, can get out there, can calm it down, and can walk away with nobody getting hurt. Those are the things that we want to learn. If you think about all of the things that we're now asking our police departments to do, we talk about procedural justice. We talk about how do we treat people fairly? How do we ensure that when people encounter the police, they feel as if it was done in a fair way? You can actually test that with this data. You could start to test what training is most effective to get us where we want to be. Oakland has partnered with the Stanford Spark to actually try to start to figure out some of these questions. And they're doing this really amazing project where they're focused on trying to use the audio from the body-worn cameras to measure respect. So imagine if we could actually do that just using the audio from these cameras. We think there's this whole amazing world of opportunity with this type of data, but we need help. The arrow is probably about as far as Paul himself is going to be able to get, and this is where we could use the help of the folks in this room and across the country. The other thing I will say, and a shout out to Greg and my good friends here, we actually had a really great roundtable on this very topic last December out in Oakland with the Computing Communities Consortium, who've written a really fantastic white paper on this. And it was so interesting. It's not just us to talk during a keynote or Roy to talk during a panel, but actually to get folks into a room talking to each other. One thing that became very clear very quickly was that the police and researchers speak a very different language. That's probably not breaking news to anyone in this room, but even when we spent literally 7 hours together talking about this very specific problem, I'll never forget Chief Went from Oakland was describing what he thought was a use case, and the researchers were saying that's not a use case that we can work from. So not surprisingly, we weren't able to solve this problem in a 7-hour workshop, but what became very clear was that we need to have deep and close relationships between researchers who are trying to develop new technologies and the people who we actually need to use them to make these things effective in some of our most critical areas. Actually, one of the things, it was kind of an almost perfect tee up. I didn't realize that Eric was going to talk about opportunities with hospital readmissions. The other thing we've seen is that certainly the data in the criminal justice system is not what we would like it to be. But one of the things that we have seen is that combinations, even very simple combinations of data, can reveal very important things. So while we certainly have a huge amount of room to grow in terms of ways that we can use data within the criminal justice system, we think that artificial intelligence can actually help us start to be predictive about upstream opportunities to intervene. So some of you may be familiar with the amazing pioneering work of Dr. Jeff Brenner at the Camden Coalition of Healthcare Providers. About a dozen years ago, he pioneered this notion of hotspotting Medicaid expenses. And he's very, very modest and very funny. The first time I talked to him, he said, I'm really just a grumpy family doctor. And the reason that I did this was because I kept seeing the same patients over and over again, and they weren't getting any better. And I wanted to understand why that was. So what he saw, and this was, I think, reflected in Eric's data as well, a very small portion of patients are disproportionately responsible for hospitalization costs. So he figured out it's just a couple of neighborhoods and it's a couple of buildings. And he went out and he found those neighborhoods, and they're pioneering this new method of simple care coordination, making sure that these people were able to get to the doctors when they needed to get their medications fulfilled when they needed to, and to help them kind of navigate life. Because it turns out that a very small number of people have very complex problems, but that if you actually help them solve their problems, you can significantly improve their outcomes and also save money, which is kind of the policy-making golden egg. About a year ago, the police and the Camden Coalition got together, and I think it was just over the course of a conversation where they realized that a small number of people that were being repeatedly seen in the ED were also cycling repeatedly through jail. So they decided to bring their data together. This is simply police arrest data plus hospitalization data. And they found some things. Again, they had the validating moment, and then they had the aha moment. So what we see is there are a small subset of people, and we think that this holds true for communities across the country, that are repeatedly cycling through multiple systems because they have very complex problems. So what we see with this population, it's a much higher percentage of folks who suffer from substance abuse, much higher prevalence of mental illness, much higher prevalences of folks who have been homeless. But if you look on the left, this is where, again, we could really use your help. So we've learned a lot of things just by combining these two very simple data sets. But the one statistic that makes me the most excited about what happened when this data came together was the very one on the bottom here. What we saw is that 60% of the people who were high utilizers, and I don't like the word utilizer when we're talking about criminal justice systems, most of my clients did not utilize the system. They would prefer not to be there. But what we see is that 60% of these 205 folks that we identified in Camden had at least one substance abuse-related hospitalization before they ever came into contact with the criminal justice system. Now, does this hold true across other communities? I don't know. There's a lot more we would need to understand about that 60% to understand what the intervention may be. But what we do see is there's an opportunity. And what that opportunity presents itself as is if we can figure that out, maybe we can keep 60% of at least those 205 people away from the criminal justice system altogether. So I think, I will say, as somebody who has spent my entire career working in this system, sometimes it's really hard not to feel pessimistic. I stood next to folks who were looking at spending the next 20, 30, 40 years of their lives in prison. I represented a client who was looking at spending 40 years of his life because he stole a lawnmower and a weed eater from a shed in a backyard. I had a person who had AIDS and was offered a 15-year sentence for stealing mangoes from a backyard. We have built this system, and it is huge and complicated and hard, and we are churning people through it on a daily basis. And sometimes it feels like we cannot turn the tide. But I am also profoundly optimistic because we are at a moment of opportunity in this country where I think we have come to the agreement across a bipartisan consensus that we don't like what we have. We have built a system that is too large and too unfair and too costly in every sense of the word, and we need to start to change it. I can tell you that there are people, particularly at the state and local level, who really want to try to figure out how we change the system. We think these types of data exchanges can actually be hugely impactful if we can figure out how to take this information and operationalize it for the folks that run these systems. So normally, when we get into a room like this, and I get all these very smart people who are really great at technology and are here because they care about social good, usually this is the time where I make a pitch and I say, we need your help. And we do need your help. But I also want to point out something else that I realized is we've been working here at OSTP for the past couple of years on this. You need our help too. Because if we don't bring the subject matter experts together with the technologists, we get tools that are built off the wrong data. And we get the outcomes that we don't want. So what I would ask of all of us is, how can you help Paul Figueroa in Oakland? How can you help Scott Thompson in Camden? How can you help the communities across our country really use the skills and the talents that you have to start to figure out what are those other opportunities to prevent people from cycling into these places that we don't want them to be? So on that note, I thank you very much for allowing me to join you here today, and I hope you have a great day.
Thank you, Lynn, for an excellent presentation. And with this, we come to the close of this AI for Social Good meeting. I was really excited to see the wonderful presentations, but I want to end by thanking a number of people. First of all, thank you to OSTP, to Ed Felton and Tara Williams, as well as to AAAI and CCC for sponsorship. I want to thank Ann Drobnis for a really excellent organization, and the staff at CCC and CRA for organizing and supporting the workshop. Reminders to everybody, all the workshop materials will be available on the CCC website, all the slide presentations, videos, everything. And there'll be a workshop report that will be released later this summer. So thank you all for attending, and we hope you enjoyed this program. Thank you.